Welcome to another episode of Well-Adjusted Mama. This is a podcast dedicated to educating and empowering women from preconception, pregnancy, birth, and through early motherhood on wellness lifestyle. I'm your host, Dr. Laura Brayton, and I'm a maternity pediatric chiropractor as well as mother who has hand-selected experts in natural holistic healthcare specialties to shine light on options and choices during this exciting phase of a woman's life. Today's episode is sponsored by Informed Pregnancy Plus, which is a fantastic streaming platform for pregnancy and parenting. Experience it for free at informedpregnancy.tv. Today's episode is all about family tips for healthy kids and happy parents. I dive deep with my guest, Dr. Laura Purdy, on how to really have a holistic, health-oriented, wellness-oriented lifestyle for the entire family. Dr. Laura Purdy, MD, MBA, is among the nation's foremost thought leaders on the future of digital healthcare. She's America's favorite doctor. Laura Purdy is a board-certified family medicine physician and the medical director of the AFD brand. Having been licensed in all 50 states, including DC, she serves patients nationwide while partnering with industry innovators to develop virtual health offerings that support a higher standard of care. Beginning her career as an Army physician, Dr. Purdy spent 14 years helping soldiers and their families through the power of telehealth. Now, she is sought after digital medicine expert and advisor for hundreds of leading telehealth providers. You can learn more at drlaurapurdy.com. Hi, Dr. Laura. Welcome to the show. I'm very excited to have you on today.
Good morning. Can I call you Dr. Laura too, or is that confusing?
Yes, please. Dr. Laura squared.
Thank you for having me. I'm happy to be here.
Yeah. So today, we're going to talk a little bit about really lifestyle and supporting the health, the physical, mental, emotional health of a family through lifestyle habits and rituals, specifically to create healthy kids and happy parents. So let's talk a little bit about what your passion is as a practitioner, as a mom, as a wife, and how you do this like in your own life and what it looks like.
Wow. Whew, that's a big question. Well, I'll tell you, so as a parent, right, I have 4 children. Their ages are 10, 8, 6, and 3. Close to this birthday season. I used to work for the federal government. And so in the federal government, that's the healthcare that you get. As what you get is what's there, and that's where you're going to take your kids. And unless you choose to break away from that system and pay a lot more money, if you want to get the free benefits, so to speak, you have to get the care there. And I remember as a physician who worked in the place where my kids were getting healthcare. So I was an employee. I would admit patients from that pediatric clinic to the hospital. So they knew me, they knew who I was. I still had the hardest time getting appointments or getting quality care or having a little bit of autonomy. We like to do flu shots and things like that. I had a hard time getting them flu shots, and it was very frustrating. And I thought, for me, as a person who works here and knows these employees, and I can walk in and get an appointment anytime I want, why am I still struggling? And if I'm struggling, having the relative advantage that I have, then what's it like for everybody else out there, parents who don't even have the ability that I have to be able to advocate for their kids in the same way? And so that's actually around the time I started doing telemedicine, but I also started using telemedicine. My kids have actually had a virtual practitioner for the last 3 or 4 years, in addition to their PCP, because the fact of the matter is that it's hard to get everything that you need when you need it. And so to circle back to your question, my passion has become finding, creating, and promoting additional ways, like cash-based system, concierge-based system, types of medicine that aren't necessarily allopathic, right? Because I'm a classically trained allopathic physician, and surprise, we don't know everything and we don't have all the answers. And so my passion has really become finding those options, not only for my family, but for others as well, and kind of amplifying and put a megaphone behind that so that people understand that they have options and don't just have to settle for kind of the old traditional way, which isn't the best way.
That's so beautiful. I mean, what you're speaking to is a team approach. We all have our different specialties that we bring to the plate, right? And it's not a one size fits all. And one practitioner cannot do it all either for that individual. So it is wonderful to have multiple, healthcare providers working with your family and supporting your needs with their expertise and their passion and their gifts.
Absolutely. I mean, and that's the way that it should be, right? Heaven forbid, we as practitioners, and whether that's me or you or anyone else, we really do our patients a disservice if we act and think and therefore treat our patients like we are all knowing. And especially because I have a lot of patients who want to explore functional, integrative, holistic, chiropractic, alternative. We call them alternative therapies, but I don't love that term. I don't love that term because alternative applies that the allopathic way is the only way. And let's face it, some of these other modalities have been around for way longer than American allopathic medicine. You know what I'm saying? And so I don't know what's a better word than alternative.
Integrative, complementary.
Yeah.
Complementary, because it's not one or the other. It doesn't have to be one or the other. It's all of it. And it's recognizing, like I think, and I've had this conversation with other MDs on my podcast, like allopathic medicine is, and this very well, being, from the DOD and then a veteran, acute emergency trauma care, that is where allopathic medicine shines and is life-saving, right? And God bless it. And when it comes to chronic illness or preventive health, maybe not so much, right? And that's where these other modalities can be really powerful and supportive. So it's also like, what do you need right now? Do you want to be preventive? Are you healthy? You want to stay healthy? Or did you just get in a car accident and, and you need something a little bit more than preventive health at that point?
It needs to come out, right? Like,
yes.
please,
surgery.
Allopathic surgeon, take that thing out,
Yes, right. So it's really like also recognizing we all have a lot of value to add and give here. And I think as moms, we're the decision makers about how to create this team. And we also can't expect, let's say, our child's pediatrician to create that team for us. Like maybe they have a couple of referrals here and there, maybe they don't, but you can learn from other moms in your community. Like that's what I find is a great way to network and understand, like, what are other moms doing and who's on their children's healthcare team or their own, right? As moms, like what's their self-care practitioners?
Absolutely. And you know what? I should actually pause and give a shout out to my osteopathic colleagues because I haven't dropped that name yet. But if you know about osteopathic physicians, right, they have an advantage. I feel like, which is what a DO is versus an MD. And I'm an MD and I went to residency. I had more DOs than MDs in my residency. And I feel like that if you're a parent who wants someone who is your physician, but maybe has a higher, tolerance level for being open-minded to other things that you may want or need, or even just to explore their options, finding someone like an osteopathic physician may be a better option because their background is definitely more open-minded and they learn additional things and techniques and skills and have a shifted mindset than the traditional physician. But I agree with you. You're right. Looking at your peers, saying who do I want to emulate? Like what sort of healthcare choices in my friends or my kids' parents, who do I want to be like? What are they doing? And how do I get to that?
Yes. And I really value what you just said. Like, look at the kids around you that are healthy, not the sick ones, right? Not the sick ones, not the ones that are constantly running nose. Oh, well, they're in daycare. I'm sorry. That's not normal for a child to be constantly having a runny nose, cough, like little cold symptoms. They're still active. They're still living their life. They're not feverish and in bed, but they're constantly in this under functioning immune system state, right? And that's not what we want to emulate. We want the kids that are active, vibrant, their eyes are shiny, they're bright, they're well rested, their skin is showing all the things that emulate health. What are those parents doing? What are they feeding their child? How much sleep is their child getting? What type of activities are they doing as a family? And how often is that child getting chiropractic care? Because I will tell you, the kids that get adjusted regularly, they do not have a runny nose at the daycare. They're the exception to the rule.
What? Okay, so
yes.
can I ask you a question? Tell me more about that, because I don't know. Like I said, I went to residency with some folks that were skilled in manipulation, but there wasn't, I would say, like in the DoD, that was not really extended to children very often. It was definitely
probably not
limited.
It was probably neck and back pain for, adults, non-pregnant adults, right?
Correct.
My practice is pregnant, new moms, and even a lot of babies and infants. And what we see with children, anybody, but children especially, when their spine's aligned and their nervous system is optimized, so their brain's communicating well with the rest of their body, they have a much stronger immune system. So, and we know that we don't get sick from germs, right? Like that's not what causes sickness. It's an immune system that's not able to respond appropriately to these germs that causes the symptoms. So we don't have to be afraid of exposure, right? Like we just have to support a healthy immune system. One way is regular chiropractic adjustments. And so a lot of families in my practice get adjusted twice a month. They're not coming in for pain relief. They're coming in because they want to really be preventive, correct any misalignments before they become symptomatic, but they all have stronger immune systems. And they also physically feel good, and then they emotionally feel better as well. And I feel like that connects the bond as a family at a deeper level.
That's so sweet. So let me ask you, I know who's interviewing who here, but I have so many questions about this because this is the first time I've ever heard of this, and I think it's really fascinating. And so I want to know, like, from your perspective, how do you let the more classical physicians in town, like, how do you let people know, hey, this is something that I do, and like you can send your patients here? Like, how do you spread the word and the awareness of what you have to offer? Because it sounds really neat.
Yeah, it's been an uphill battle. My practice is almost 20 years old in Hoboken. I've been, in the same town this whole time. And, because I love working with pregnant women and babies, which is very unique to a chiropractic practice. A lot of the other guys in town are they're doing an excellent job taking care of neck and back pain for, let's say, guy, right? For a lot of men, right? And women too, but not really that pregnant postpartum body, and certainly not babies, infants, and younger children. Like that is not their niche. So I was like, how do I connect with the OBs in town? How do I connect with the pediatricians in town? And I did. I went around and introduced myself to all of them. And they're still, for the most part, their response is like, let's say the third trimester pregnant woman's having back pain, they'll send her over. Yeah. Maybe, breech baby. Okay, so go to the chiropractor because she does Webster technique. That can help a baby turn and go head down so you can avoid a cesarean. It's a pretty big deal. It's 85% effective. Yeah. But it's still very much symptom relief. And there's still a little bit of a lack of like, what is preventive health? It's just almost like outside of the mindset of so what you're speaking to is somewhat unique, because I would find the average doctor is still very much dealing with symptoms, and symptoms are already beyond the maintenance, preventive wellness care that we ideally want to be caring for our patients. So it is a different philosophy. So what happens is these patients come in, let's say with pain, typically as a new patient, and then with education in our practice, we educate the parents. This is what we offer. And a percentage of those parents resonate with it and choose to sign up for this wellness care. And then a percentage are like, I'm just here to help my infant breastfeed better, which is great. So that's what we're going to support you with, and be less colicky and have a bowel movement every day, and all the things that are, we want to normalize infants' function and not, normalize common infant symptoms, right? Oh, okay, your baby's spitting up every feed, or your baby hasn't pooped in 5 days. Yeah. Oh, that's fine. That's fine. No, that's not fine. It's not fine. So like, it's like, yeah. So it's like recognizing like, yeah, that might be common, but common and normal aren't the same thing. And so what do we do to help support your baby in having optimal function with all they have to do is feed, eliminate, and sleep. That's all they have to do as a baby, right? So if there are challenges in any of those areas, potentially all three, how do we support them? And we can do that naturally without drugs to support their system and having just normal autonomic function. So that's really what I find. And like I said, a percentage of families are like, I just want to, it's out of pocket, it's self-pay, right? So they're like, I just want to come in and help my baby breastfeed and not be gassy. And we're doing the pre and post frenectomy body work to help with tethered oral tissues and getting and so that's great. And, they're not interested in the milestone support. Like if I see that baby once or twice a month, that first year of life, they're going to roll on time. They're going to sit, crawl, all the things, because this is all musculoskeletal and it's also very neurological. And if they're, for example, only rolling one direction, or they're only looking one direction, they're, when they're crawling, they're dragging one limb. These are all showing asymmetries in that baby's development. And we want babies to develop symmetrically, right? This is so important. So that's what chiropractic with a pediatric chiropractor is able to provide. But to your point, you're not going to see that in certainly the DOD or really even, some average chiropractic practices. You have to find someone who specializes in this type of care. And the ICPA4kids.com is a resource so people in their area can find chiropractors that are really caring for pregnant and new moms and understanding that this is not just an average woman's adult body. The body is different when it's going through that perinatal phase and needs different type of care. And then also the same thing with caring for young children. So, and really understanding, like, I don't want to just see a child, God forbid, they fall off their bike, right? Or have a concussion or, these types of things too. We care for that, but what about just helping with normal milestone development, right? Or what about helping with having your baby go poop every day? Like, that's what we do in our practice.
Wow. Can I tell you a story? A story is coming to mind. And at the time, I was in the DOD, and so they didn't cover chiropractor care. But my third baby, which was the third baby, they all were delivered naturally. The first one was a vacuum. That's a whole story. But the third one came out with a compound arm. And consequently, he had a congenital torticollis. And we'll talk about that in a minute. But he subluxed my pubic symphysis because his collarbones didn't do what they were supposed to do. I cracked a tooth pushing him out. It was a whole thing. It was a big deal. And you're talking about postpartum, new mom bodies, right? So I was in the military, and I don't know if you knew this, but you kind of have to start running and exercising again immediately, because at that time they were requiring women who had given birth to take a physical fitness test, which was push-ups, sit-ups, and a 2-mile run 6 months after delivery. So I had delivered my third child. I didn't know at the time that my pubic symphysis was subluxed because that's not something that a traditional mainstream allopathic obstetrician gynecologist is going to check into. But
did you have difficulty walking?
So here's what happened. I always would give myself 2 weeks. I know this is just going to make you cringe. You're going to just cringe, but I would give myself 2 weeks and then start running again. I know, but I didn't have a choice because I failed my PT test with my first child. I got held back from graduation, didn't get an award, was publicly humiliated. And I said, I'm never going to, it was horrific, right?
That's horrific.
So I went to go running and I took one step on that treadmill and it felt like someone was stabbing a large carving knife right into the middle of my pubic symphysis. And it stopped me in my tracks. I just said, like, what is this? And it was so bad that, if a angry dog was chasing after me, like if a code blue was called in the hospital, I physically couldn't run because of the pain. So they wouldn't pay for a chiropractor, but they would pay for a pelvic physical therapist. And I imagine there's some overlap.
There is.
There has to be. Of course, I saw my doctor. They took an X-ray, and there was a lot of DOs. Thankfully, I had a DO who was seeing me, and they were able to kind of say, like, you got something.
They diagnosed you.
They did. It hurt. You could touch the pubic symphysis, which is how would you describe it, as like the fibrous part between the two pelvic bones. and it was horrific.
Yeah.
So the moral of the story is the punchline is I went to see a pelvic health physical therapist and was there for probably 6 months. And they did adjustments, like they did things and it popped and it hurt and they needled and all of it. And they cured me. I mean, he's 6 years old now and I've had no problem since then. And ever since then, I've been a huge advocate for especially the pelvis, because sometimes we say pelvic and that doesn't always mean vagina. Pelvis is also bones that get out of place when you give birth. And
the pelvic girdle,
right? The pelvis as well as the pelvic floor both need attention. And it was life-changing for me. And I have been a huge advocate for that ever since then, because I can't imagine where I would be today or how much I would still be suffering if I hadn't been able to get that care at that time.
You needed that hands-on body work. Yes, in my practice, I have a pelvic PT. And so we co-treat a lot of women, sometimes during pregnancy, but especially postpartum. You look in Europe, like countries like France, every single postpartum woman is seen by a pelvic physical therapist approximately 6 weeks postpartum, sometimes 4 weeks, because every woman needs to get checked. And to your point, a lot of that type of work is pelvic floor specific, which is very important. Our pelvic floor is very underappreciated. But what I love about it is it is preventive. I mean, certainly you could be treating symptoms. There could be pubic pain, like you mentioned. There could be SI joint pain. There could be incontinence. There could be pain with sex, all these things that can happen after a woman has, especially a vaginal delivery. But what's I think even more eye-opening, what we see with women that are our mothers, our grandmothers, and they have 3, 4, 5 kids vaginally, and never received any sort of care or support postpartum. Their organs are falling out of their bodies decades later. They're peeing themselves. And it's just considered like, well, you're 50, 60, 70 years old. So wear a pad, cut out your uterus. You don't need it anymore, whatever. It's like not okay.
Sling, surgically suspend it back up in there.
Yeah, the mesh, which has a lot of side effects. Surgery only needs to be the last resort. And prolapse typically is not an emergency situation. It is chronic. It's years of not only birthing babies and carrying babies, in utero, but then it's lifting, it's all the child care, and it's not healing your abdominal wall, the diastasis. It's not learning how to strengthen your pelvic floor and lift it to hold everything in place, and using the muscles to control our urine and feces, right? So like these are real things. And, it's beautiful when you have somebody who's really taking care of this part of your body that needs support. I feel like universally after going through pregnancy and birth, and cesarean or vaginal. And then also, like your point, addressing the pelvic girdle alignment, which is really something that chiropractors shine in. And so I'm working on those, stabilizing the pelvic girdle, specifically the sacroiliac joints, which are the bones in the back where the pelvis, the pelvic, the ilium and the sacrum meet. I don't know how
bones.
The back. Yeah, exactly. Back there. And that creates a lot of pain for pregnant and postpartum women too. And and it could even go into their glute and they're like, oh, I have sciatica. Well, it's not technically sciatica, but it is an irritated, inflamed pelvic joint. And it could be in the front or the back, like you mentioned with the pubic bone. And we need to get that joint in alignment so it can heal properly. And that's what this type of body work does. And some osteopaths will do manipulation and support that pelvic girdle alignment as well.
And your window is very narrow, right? Like you only have a few weeks while the hormonal, I don't know what you would say, environment of the body still allows a little bit of in those ligaments. And if you don't intervene, this was my problem. If you don't intervene within, 12 to 16 weeks, but before the ligaments harden, then I would assume it's a little harder to get things adjusted.
I will say any type of injury that's been around longer is going to be harder to heal. Sure. So let's say the injury is from your actual birth. So you have a date of when this happened. Sure. I see women immediately after they've given birth, like they come to my office on their way from the hospital, because we're going to support the healing of their body so much faster than weeks later when scar tissue's developed and also incorrect biomechanics are created. We have to like repair and reverse that type of muscle and body alignment education that we can fix a lot sooner. And the same thing with an infant. Yeah. If the infant has misalignment and strain from the birth process, I want to see them right after birth. I don't want to wait till they're 3 months old with a torticollis. That torticollis was from their birth, and we can correct it immediately after they're born. Like, we don't have to wait. The longer we wait, the harder it is to repair and heal. So I would say that's with any musculoskeletal injury, right? So that's so important. So with your household, you have 4 young children and you're a working mom. Like, how do you support a healthy lifestyle for your family? How do you manage that? Like, sounds really intense. I have 1 child. That is like, I can't imagine 3 more.
Well, I will be honest with you. It is very challenging because not only do I work, I travel, I have appearances, it's my career has really evolved. And I think for me, right now, honestly, the focus and the emphasis is more on their emotional and their social kind of mental health. Of course, we prioritize physical health, but we just moved, right? I lived in Nashville, just moved a few months ago. I acknowledge that I travel a lot and I'm not around as much as I would like to be. They're kind of away from the friends that they used to have. And so they started a new school, which is a different type of school. And so right now I'm really placing the emphasis on their emotional and their kind of like mental and spiritual health to make sure that they're safe and healthy in their hearts and minds. Now, of course, we try to eat healthy. I have a couple picky eaters and I have a 3-year-old. So I have 2 that are really great and will eat just about anything, and 2 that won't eat whatever I put in front of them. But they're very active. They're all very physically active. We live in Florida now, so they love to swim. We walk the dog. I try to find out what they enjoy and then lean into that a little bit. If they like going outside, if they love going to parks and museums, and I think physical activity is some of the best things that we can do for them if they're having a tough day or if they're struggling to stay balanced, getting them out, focusing on, nature or physical activity or going for a swim or going to the beach, appreciating the beauty of the world around us can really go pretty far. But for their whole lives, if I go all the way back, right, I prioritized breastfeeding, and I know not everyone is able to do that. And I feel very fortunate that I was. So I breastfed all of them for as long as I could, which, I mean, the 10-year-old and the 8-year-old weaned at the same time. Okay. So that was a very long stint of nursing, and the boys didn't care for it as much. But so because of that, and I don't know if it's because of that, but consequently, we don't have food allergies. We don't have skin allergies. There's no eczema. There's no asthma. There's no, one has a small amount of environmental allergies, but not really. There's no animal allergies. There's no food sensitivity that I know of. We don't, you mentioned, going to daycare and getting sick. The 3-year-old just now started going to daycare because he was a pandemic baby. And so there was always in-home care. I mean, in 4 months, the whole house has been sick one time, which I feel like is a pretty typical sort of a beginning of.
And probably responded well. Like, in other words, they weren't sick for weeks. It was like sick for a couple days and then on with their life.
I mean, there's never been an instance, and you're talking about in 10 years. Okay. There's never been an instance where everyone in the house had vomiting and diarrhea. Never. There's never been a crazy GI bug where everyone was throwing up, or a crazy diarrhea bug where everyone was in the restroom. Has there been moments in time where maybe somebody threw up one time, or sure, but never this like long drawn out, catastrophic, life altering illness. And so I feel like, but I tell you what I am is relatively strict on bedtime. Like, we go to bed at the same time every day and have for forever. Maybe an hour variation on vacations or in the summer, or if you can't help it, if it's a holiday and family's over. But bedtime routine, set bedtime. There's no alarms. Like, I do not set alarms ever for myself or for them. We wake up naturally at the same time, which gives us enough time and makes sure that they have breakfast. The oldest one is old enough to kind of say, I'm not really hungry. I think I'm more of a dinner person than a breakfast person. And so I allow her to kind of honor that. But with the 6-year-old, I know if he doesn't eat breakfast, we're all going to feel it, later on in the day. So we prioritize breakfast. I prioritize toothbrushing and hairbrushing and showering and bathing and just general wellness, and try to teach them that as well. And it feels like a healthy household.
If you are in a quest for empowerment and information, I highly encourage you to dive into the world of knowledge and support with Informed Pregnancy Plus, your all-in-one streaming platform dedicated to guiding you through every step of your pregnancy, birth, and postpartum journey. You can stream a growing library of 20 documentaries, including ionic films like Orgasmic Birth and The Business of Being Born, which have revolutionized the way we view childbirth and maternal care. These groundbreaking films, along with our extensive library of films, web series, workouts, make Informed Pregnancy Plus an unparalleled resource. Dr. Elliot Berlin and the team at Informed Pregnancy Plus just announced their newest edition, a vitally important course called the Core Connection, From Anatomy to Action. This exclusive 5-episode series is a must-watch for anyone looking to enhance their pelvic floor and core strength during and after pregnancy. Discover the essentials of pelvic floor health, learn vital postural adjustments, explore muscle releases, and master breathing techniques for a stronger core. This empowering series equips you with the tools to maintain balance in your pelvic floor and core muscles, ensuring optimal functions throughout your pregnancy journey. It's all included with your subscription of less than $7 a month. Ready to transform your pregnancy and parenting experience? Check out informedpregnancy.tv today or download the Informed Pregnancy Plus app on Apple, Android, or Roku. Start your free trial now and join the community of informed and empowered parents. Yeah, and so I want to just backtrack a little bit about having overall healthy children. I agree. Breast milk and breastfeeding are great ways, and also vaginal deliveries. I heard that you had 4 vaginal deliveries. So I would say for a mom who has to have a cesarean, there's the vaginal swab. You can still swab your baby post-birth with your vaginal flora. That's that good bacteria that's going to help seed their gut that they would typically swallow as they're going through the birth canal, right? So we want to really focus on that microbiome, that gut health, and that gut development, which is immature that first year of life. So we want to support it. Probiotics can be really helpful. And
I did that. Also, I did probiotics with all 4 of them, and it made all the difference.
Probiotics, they get probiotics from the breast milk. They get probiotics from skin on skin, which is breastfeeding or just holding your baby. And that could be either partner against your skin. So the bacteria on the skin is also transferred to your child. You and your partner's bacteria are going to be the bacteria that genetically your child needs, not the doctors and nurses in the hospital, not other caretakers. It's that your bacteria that is going to thrive and help them replicate and make more millions and millions and millions of these bacteria that first year or so. So like this is really important for immune health as well, because we know our gut is 78% of our immune system, right? So that's huge. And then, food, nutrition is huge, back to that gut health. So, when you're talking about food allergies, asthma allergies, that's all leaky gut. What causes a leaky gut? A gut that didn't have that development as optimally because it didn't have the good bacteria it needed. Perhaps food was introduced too early to that infant, right? And the wrong types of foods. And, we want to have easy to digest foods in the beginning. We don't want to do the grains and things like that. So like that's also setting our child up for healthy gut development, which is correlating with everything you're saying with the chronic allergies, asthma, eczema. That's all gut inflammation, right? So, and if we have that, then we have to go back to the gut and heal it.
We didn't, ear infections is another one too. A lot of people talk about ear infections. I had one kid who had 2 or 3, and then the pandemic happened. We weren't around people as much, and he never had one again. So I'm not sure what that was about, but haven't really had a lot of ear infections either. Never had UTIs. We don't get pink eye very often. Less than once every 4 years.
Yeah. So this is all indicative of immune health, right? And so the lifestyle, the sleep is so important. I like when you're traveling, you obviously have your team still initiating and imposing these bedtime rituals for the health of your child. And I know, like for me as a working mom, I get home later on Mondays and Thursdays. And my husband, I'm like, listen, honey, you gotta like get this bedtime routine going if I'm not here or not, right? You have to have that. The team has to be on the same page as well, right? About being strict around that. Can you talk a little bit about screen time? I know for me as a working mom, that can be challenging sometimes, and there's working mom guilt. So what do you do about that?
I let him have it. If I'm being totally transparent, there's only so many things I can control. And I've gone through phases in my life where there's been none. I've gone through phases in my life where there's been only 2 hours. I've gone through all the phases, right? And I finally resigned myself to the fact that they're all really, I'm really trying to.
And there's different ages too, right? So obviously that's.
My 3-year-old doesn't use it at all. Doesn't use it, doesn't want it, doesn't care. I kind of wish he would. Then he would quit trying to jump in the pool all the time or run out into the street. He cares more about being physically active. But I think I have gone through I have guilted myself. I have been so unkind to myself as a parent for every little thing. Like, oh, I feel guilty for traveling. Oh, I feel guilty for working. Oh, I feel guilty for screen time. Oh, I feel guilty because they're not, doing this or doing that. And so I think where I have landed with the screen time is obviously they don't use screens for the majority of their days because they go to school. They're outside of the house. I don't allow it before everyone is ready for the day. So get up, get dressed, clean yourself, brush your hair, brush your teeth, have breakfast, and if there's time, then maybe, but I don't put a limit on it. I don't even try to, because I'll go nuts and I'll feel like a bad person for creating arbitrary rules that I then have to arbitrarily enforce. But what I do is I'm very vigilant about what they are putting in their eyes and their ears. And that includes who they're talking to, right? I'll give you an example. Just yesterday, one of my children was actually video chatting one of their friends, and another child was in the background in something very harsh and unloving, and bringing the energy that just has no place in this house was said. And I actually said, you must turn that off. And then went forward to communicate to that family why it was turned off and where that boundary lies for us. So I tried to keep them close to me so that I can hear and see what they're doing. There's only certain programs and things that they're allowed to use. I prefer educational material so that they can at least be gaining something out of it. But I definitely am a pretty ferocious guard dog about what that gateway to the external world is allowing into, because like I said, emotional, physical, kind of mental health, right? I acknowledge that is a doorway into my home, and I am very careful about what I allow through it.
Wow. I mean, and you're talking about a 10-year-old.
Absolutely.
Wow. I mean, it's just like, even like, I'm like, oh my God, I can't like handle like my son having a phone in a couple of years. Like, just so.
No phones, iPads, TVs, but no phones. I'm not ready for that.
Or a watch. But anyways, yeah, like at the end of the day, being able to like have a video chat, like that just blows my mind, because it's just not like we didn't grow up with that access, right? We weren't able to call our friends on video or message them or.
I think it's beautiful though, because that's how they can call my mom, they can call me. So I started teaching my girls, because they're the only one, the oldest 2 are girls, the youngest 2 are boys. So, 10, 8, 6, and 3, the top 2 can read and write and understand. So I started intentionally teaching them communication etiquette through their iPads well over a year ago. When I started traveling, I downloaded a child's messenger app on there, because they need to know communication etiquette.
Yes.
So I started it with me. How do you text? How do you call? When do you not? How do you respond if somebody can't talk to you? And then how do you engage in that etiquette? And so after a while, now they talk to me, they talk to their dad, they talk to my mom, my brother. a couple of adult friends of mine who I trust to, my best friend who's down here with me. She just had a baby too. And so then it was safe adults. And now there's a very selective, curated list of safe children that they're allowed to. And honestly, most of them are my friends' kids. But I still listen and surveil everything that's happening. I personally don't ascribe to that mentality of no, 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 because if they're not taught how to use it respectfully and ethically with etiquette and social graces, I can't expect them to do that when they're a teenager or an adult.
Yes, that is so true. And you even raise up another point, like it's one thing to send somebody a text message, but to be able to do a video call or call them on the phone, that takes another level of communication. And there's somewhat of a concern that generations, like let's say kids in their 20s, young adults, I should say, they don't know how to pick up the phone and call somebody. Like it's like they want all the communication to be a text. And texts are great for certain things and they have limitations, right? And if you really need to communicate with somebody about something important and you can't be in person with them, you really need to do it over a call, right?
Sure.
And being comfortable talking to someone on the phone or in person, I see these young adults, like that's uncomfortable for them.
Yeah.
Like they'd rather just send a message.
You know what's really interesting?
So we have to teach our children how to do that is what you're saying. It's not necessarily intuitive.
No, and to communicate with different people. I'll give you another story. Very, very recently, I had a really interesting conversation with one of my child's friends' parents. And that parent was upset and offended that my 10-year-old wanted to say hello to them when they were in the background of their friend's, video chat. And this parent was saying, how rude, how out of place, how dare she want to say hello to me? And I kind of laughed a little bit. And I said, I've taught my children to feel comfortable speaking with everyone, older, younger, peer, teacher. Of course, they see you as a human, not as an adult. And it was striking to me that there would be adults who just don't want children to talk to them because children are nothing more than evolving adults, right? I mean, they'll be there someday. And I don't want them to feel like they can't talk to people. They see, humans as humans. I think communication is a huge part of wellness, right? Being able to communicate to others and communicate your needs and understand how other people communicate. Now that we're talking about it in real time, I've never said it out loud, but communication is a huge part of wellness. And that is something I've very intentionally worked on with them, communication with the world, not just with peers. And it's sad when other adults not only don't emphasize it, but don't understand the value of it as it pertains to the generations behind us.
Yeah, that's definitely like an old generation mentality of children are, really just to, not speak for themselves, right? They just have to sit, be quiet, they have to just do whatever the adults tell them to do. And that's it. And, that's toxic. Like, I think, as a parent, it's like, oh, I wish my child did everything I said I told them to do. Oh. And my husband actually thinks that our child is misbehaved because he doesn't always follow what we do. But there's an autonomy there. Yes. And even at 6 years old, there's we need to, if we ask him to do something, he wants an explanation of why. And that actually came up this weekend. He's like, if you told me the consequences, then I wouldn't have done it. But to him, just saying, don't do that, and he didn't know what the consequences weren't enough, right? And the consequences were like more Legos got thrown all over the house and it was a mess. And nobody got injured, nothing broke, but it was like, I told you not to do that. And now we have 10, more minutes of cleaning up Legos, right? At the end of the big picture here, not a big deal. But when he said, I didn't know that was going to happen, I was like, oh. And I did know what was going to happen. So I just needed that extra sentence to tell him, because he's old enough to understand, if you're doing this, this is going to create this problem. And so I think that is a higher consciousness parenting that we're all getting called to, because myself and my husband were not raised that way. And certainly the grandparents were raised even less so. And so we're all learning, honestly, about treating our children really as equals, is what you're saying. We're not superior to them. It doesn't mean we're not parenting them. It doesn't mean we don't have structure. We don't have rules. And we're still acknowledging their thoughts, beliefs, their priorities, their whatever. Like we're communicating that. Even with little ones, we can communicate that and respect it and still create boundaries and structure, right? Like it's a delicate balance.
Somebody told me very recently, actually, I was kind of debriefing from that situation that I just shared with you. And somebody said to me in kind of decompressing after that learning how to handle and navigate these situations and also emulating and demonstrating it to the children is actually a way to ensure some of their long-term mental wellness. And it's a protective act that we can take as parents to teach them how to navigate these difficult social situations with people who may not have been raised with the same level of, you could say higher consciousness or insight, maturity. What's the word I'm thinking of? Conscientiousness, empathy, respect for other humans. That is 100% a tremendous preventive care tool, because children who cannot communicate and cannot express and cannot identify their own needs then become adults who can't do the same thing. And then they enter into toxic relationships. They allow themselves to become victims. They end up in abusive relationships. They end up in jobs that hurt them. And they can't take the steps, just like with physical health and wellness, they can't take the steps that are necessary to protect their heart, mind, body, and then the children that they end up being responsible for caring for. I mean, you want to talk about preventive health. There it is. I mean, right there.
Amen, Dr. Laura. And you know what? I mean, I never really actually valued communication as a wellness tool. So this is like an aha for me right now as we're talking.
Light bulb.
Light bulb just went off. Because certainly, what has come up in previous podcasts is intimate relationship communication, and especially during pregnancy and new motherhood, how your communication with your partner is so crucial for the health of your relationship, and why that's so important during this hormonal major life change of making and birthing a baby, right? And raising a baby. It's a lot of work and it stresses relationships, right? And so that's where learning these communication tools, even ideally before the pregnancy occurs, is ideal, right? Because it can really help create that team, right? Of we got this, we can figure it out as we go, because we're both new to parenting and it's scary and challenging for both partners, right? So, but wow, what a beautiful thing to model for our children, of how we're communicating with our partner and our friends and our family members. And then, when these types of interactions happen, it's like, okay, this isn't about, you didn't do anything wrong, right? You are doing what we taught you, and other people are going to view that differently. And that's okay, right? It doesn't make them wrong either. It's just they're coming from a different perspective. And then how do we move on from that? We don't have to be hurt by, how do you heal from that? Okay, when somebody reacts in a way that might feel judgmental or shut down, how do we just say okay, that's them, that's me, and move, how do we move on? I don't know if move on is the right word, but just process and let it go.
I think teaching compassion goes a long way, right? So my children in the place where we lived previously, the older two experienced some bullying. And that was actually one of the big reasons why we moved, because I was heavily, aggressively bullied to the point of changing schools when I was in middle school, and am now a huge advocate for anti-bullying movements and partnering with some nonprofits to really help with that, because I am very passionate about it. But having those conversations in a way that makes space for compassion and empathy for the other people, right? So Eleanor is my oldest child, and after this instance, she actually said, I don't want to read these messages. I want you to read them. And I said, well, you could if you wanted to, because I'm not going to say anything to anyone that I wouldn't feel comfortable with you hearing and seeing. But also, I want you to understand that you can still be loving. You can still be loving to other people when they're not giving love to you. You can still return it to them and have compassion to understand, like, wow, it must be painful to live a life or be inside of a body or a mind that hasn't learned how to be compassionate and empathetic to other people. That's a torturous existence, right? Being aggressive towards other people, that's energy expensive. It ruins your mind, it ruins your day. And it is, and these are all things that we can teach, but they have to be skills that we have before we can teach them. And I've spent, I'm almost 40, right? So I've spent at least the last 15 years developing this maturity very intentionally in myself. But this is not something, this is work. This is work. It is actually, it is definitely self-care. It is definitely an area of wellness, an area of health. It is, it's our body, it's our minds. And we have to really have a good, strong handle and mastery on that before we can pass it along. But that's the same thing as everything. Like sleep habits, eating habits, exercise habits, chiropractic adjustment habits.
Yes.
We must model them and then pass them on.
We have to model them. This isn't like you're getting your sleep, but I'm going to, get 4 to 5 hours and be a zombie. Like that is so, like, kids just see right through those types of, I can't remember the word I'm trying to, like, you just can't be, double standard. Like, you're going to eat this healthy food and I'm going to eat this crap. Like, you're going to go outside and exercise and I'm going to sit on the couch. Like, no, we all live this together because this is our family and this is how we live as a family. And this is our family philosophy on health.
Correct.
And, like, that's so, it just becomes like, this is how we operate as a family. And it is something that you kind of have to learn and evolve as you're, figuring out parenting, right?
Right.
But yeah, it's like you said, as a mom, especially when we do this development work, like you're talking about, this personal development, this deeper type of work, we get so clear. It's so, we're so in touch with our intuition and we're so clear about what we need, what our family needs, and what we don't need, right? Like what you're saying, it's very like, no, that toxic behavior is not allowed in our family. That's not how we operate as a family. That family can choose to operate in their way, and that's fine, but that's not how we're going to choose to operate and behave and treat others. And I think that's so beautiful. Like, there's just like, there's no gray. I mean, there doesn't have to, sometimes there's a little gray, but like these types of things don't have to be gray, right? It's very like, I know what our family needs, and moms lead the show when it comes to the healthcare of their family, all levels of healthcare, right? So when we're practicing health and wellness and modeling it, and we're feeling good and we have a full cup to give to our family, then the whole family benefits.
Agree. Honestly, 100,000%. And it's okay, right? Because I feel like as moms, you talk about guilt and burning the candle at both ends. And I actually don't use the phrase working mom anymore unless men are going to start using the phrase working dad. Forget it. No.
Interesting.
No, I don't say working mom because I've never heard a man say working dad, right? And
I have never heard a working dad. No, I've never heard that.
For me, it doesn't make me less or more. I mean, it certainly means society expects more of me. And I've definitely been criticized and ridiculed and treated like I'm lesser than because I work. But no, I'm not a working mom. I'm a mom and I do have a career. And but the thing is that being able to do that, sort of modeling for them and saying, you know what, I'm not going to run myself ragged. I do work. Of course I do. But you know what? I will get my sleep. Do not come and wake me up. I will come out when I'm ready. And that's a boundary, right? It's a boundary. I will go and take a shower and I will have privacy during that time, right? Except for the 3-year-old. I mean, what can I do? I will, now we're getting to the point where it's like, I will dress in my room and have privacy and I will be out when I'm finished. I will stop and eat. And even if I have more work that I need to do, or if I have a late meeting that I could not take because I try to protect, or I couldn't avoid because I try to protect those hours, I say, I would love to spend some time with you right now, but I need to go do this meeting because I have an obligation, or I need to finish this piece of work because I have an obligation to that. And helping them understand how that is all integrated, I just think it's just so healthy.
It is so healthy. And, it's recognizing also, like, as much as we love our children, taking these work meetings does not mean we love them less or we don't want to be with them. But we also, as women, need to fulfill all sides of ourselves, and our mother, being a mother is only one part of us, right? And so the other things that you're choosing to spend your time doing are filling you up in other areas, right? And if they're not, then you cut them out of your life. Yes. But it's like, oh, that meeting fills me up. I'm landing this $1 million deal. I'm like, these are like things that could be really exciting and invigorating and bring life to us that, that there's value there. Let's just put it that way. Right. And so like, that is really important. And I think that isn't great to model for our children too, boys and girls, seeing mom doing all the things and choosing to live her life on her own terms.
Oh yes. I'm very intentional to make sure that my sons are around powerful, loving, compassionate women, some of whom have children and some of whom don't, some of whom have grandchildren. But on, almost all the executives in my company are women, and they love the kids, and the kids can come around. And I think it's so important for me. And again, that was part of moving to Miami, was I wanted them to see other women and other mothers who are like me. I don't need to be the only, I hate to use the term, working mom. I don't need to be the only career woman that they see. I don't need to be the only one who's out there and traveling and doing deals and like being on TV and being on podcasts and being in magazine covers and on the public and running companies and being a CEO. I don't want to be the only one. I want them to see many of them so that they have a wide range of people that they look up to and respect, and they can pick and choose and say, I like this, I like that, I like this, I don't like that. And then they can start to create their own identities and really adopt what they see around them. It's so important for me, for them to see more people who are in alignment with that so they can decide if that's what they like.
Yeah, I think that's so important. These healthy role models, it doesn't just have to be us, right? Like that's a lot of pressure also to put on ourselves. We can fill our child's life with healthy role models and have that exposure. And I think that's just so beautiful because they're learning from all of those people. They all have something different to different gifts to model for our children.
And it's many sources of love, right? What I care about is their lives being full of real, unconditional, without stipulations, love. And I will give that to them, right? But the more people that I can put in their life who become sources of love, then we're building a really meaningful, high quality life for them, that it does not just depend on that umbilical cord, if you will, to me. They are completely surrounded by love. Because I lost my dad when I was 23, so 15 years ago. And thankfully, right? I mean, he was one of the most biggest sources of love in my life. But when he was gone, there were still more sources of love in my life, from family, mentors, friends, teachers. I can only imagine what it would have been like if that was the only source of love in my life, right?
So even as an adult, like that's still, yes, we need multiple sources, and that's beautiful. And then also, our child has more, more love. I feel like they become more of a loving individual, right? When they're just showered with love, right? That's what we're creating, this next generation of loving individuals that value peace, right? Like what a concept. Speaking of DOD, it's like, what if we don't need a military?
Fascinating, isn't it? I mean, my goodness. Imagine a world.
That's a whole other podcast.
Imagine a world where everyone was compassionate, empathetic, kind, and loving. I mean, geez, we'd get so much done, wouldn't we?
We'd get so much done, and we would, redirect our resources in a lot different way. We wouldn't have to be dumping billions into warfare, right? So, Oh my gosh. Well, anyways, Dr. Laura, this has been a fascinating conversation. I love that we've taken a lot of turns along the way, but there's a lot of value here. And I just really appreciate you coming on the show today.
Well, thank you for having me, Dr. Laura. It's been fantastic to spend some time with you. And thank you for this wonderful podcast. I feel like, I feel so happy and I feel so full, and I'm thrilled that we got to have this conversation. And I hope that the people who listen to this maybe learned something, maybe opened up to new perspectives, maybe let go of guilt or shame if you have it, and maybe received something that you can put into your life and your family.
Definitely. And if they want to contact you and have access, drlaurapurdy.com is your website?
drlaurapurdy.com. I'm also on Instagram. So the website's undergoing a revamp, and that's going to change, but it still works right now. And then at America's Favorite Doctor, spelled just like it sounds, is where I am on Instagram. Come and send me a message, right? And you can see my virtual primary care clinic from there. I love to hear from people, especially if you say, hey, I saw you on the podcast. I think that's great. And I look forward to hearing from you all.
Awesome. Thank you.
Thank you. Bye.
Well, I hope you enjoyed today's episode with Dr. Purdy. I always enjoy having a fellow healthcare practitioner also who's a mother and who has the life experience of both together, because it's quite a unique combination to be a mom and a doctor, and really practicing what you preach and sharing and modeling for the next generation about what health looks like. And what we find is that when parents are following that healthy lifestyle and modeling that for their children and doing it together as family bonding and activity, then we really see a shift in the dynamic for the mood and the mental, emotional health of the entire family as well. So I feel like it's really foundational to not only live that lifestyle, but to live it together as a family.